This is a call to action for young women across the nation. Are you aware that heart disease is the leading cause of death for women? And are you aware of what you can do personally to improve your heart health? The American Heart Association's Life Simple 7: manage your blood pressure, control cholesterol, reduce blood sugar, get active, eat better, lose weight, stop smoking. This is a conversation you should have with your healthcare team. Also, are you aware that heart disease death is increasing among young women, particularly young Black and Hispanic women? Know the warning signs of a heart attack and seek care immediately. My message to each of you is please show your heart you care.
The Mediterranean and the vegan diet have been most proven to reduce cardiovascular mortality. Just a few heart-smart tips. Number 1, avoid fatty meats, fried foods, and full-fat dairy products. Number 2, avoid simple sugars, bread, pasta, potatoes. Number 3, be aware of sugar-sweetened beverages. They just add extra calories. Number 4, purge processed foods. If it comes in a box, a can, or a bag, it's likely not healthy for you. Number 5, practice good portion control. Stick to the recommended serving size. Remember, the better you fuel yourself, the better that you'll feel, all while reducing cardiovascular disease. So choose wisely.
Did you know that high blood pressure or hypertension is also called a silent killer? Because most of the time there are no obvious symptoms. Normal blood pressure is less than 120/80, and hypertension is higher than 130/80. Nearly half of US adults have high blood pressure, and 45% of those with hypertension do not have it controlled. Untreated hypertension can lead to heart attacks, strokes, or heart failure. Things you can do to control your blood pressure: eat a well-balanced diet that is low in salt, limit alcohol, enjoy regular physical activity, manage stress, maintain a healthy weight, quit smoking, take your medication properly, and work together with your doctor.
More than 40% of American adults have cholesterol levels in the high level, higher than 200 milligrams per deciliter. Cholesterol is a fatty substance that can build up and damage arteries, leading to heart attack, stroke, and other vascular problems. But high levels of cholesterol can be controlled with a healthy diet, sticking to a healthy weight, not smoking, exercise, and taking cholesterol-lowering medications if needed. Take control of your cholesterol. Use these cholesterol-lowering strategies and improve your cardiovascular risk.
Did you know that diabetes is a significant risk factor for cardiovascular disease? There are a few simple things you can do to decrease your risk. First, avoid carbohydrates like bread, cakes, cookies, and pasta, and replace those foods with fresh fruits and vegetables. Also, increase your activity. Even walking will decrease your blood sugar levels. By making these simple changes, you will decrease your risk of diabetes and improve your overall cardiovascular health.
Hello and happy Heart Month. No mother should ever die as a result of pregnancy. So it's important to make every prenatal and every postpartum appointment and make sure to report anything that doesn't feel right.
My clinical practice focuses on preventative cardiology as well as treating heart disease in patients who have autoimmune rheumatologic disorders such as lupus, rheumatoid arthritis, or psoriasis. Many people are unaware that patients with these conditions are actually at increased risk for heart disease, and they tend to have an atypical presentation for heart disease when it does occur. So my message this Heart Month is that if you have an autoimmune rheumatologic disorder, that you consult with your physician and have a discussion about getting an overall cardiac risk assessment. And importantly, if you have any symptoms of heart disease, that you see a cardiologist for further evaluation.
Clinical trials are research studies that help us understand whether a test or treatment works. Why should you enroll in clinical trials? Heart disease is the leading cause of death in women, and research has shown that women may respond differently to treatments than men. If you would like to learn more about clinical trials, please talk to your doctor.
My research focuses on adverse social stress and its impact on cardiovascular disease risk in African American women. Stress is an underemphasized yet important risk factor for the development of heart disease. So for Heart Awareness Month, ladies, take inventory of your stress levels so that you can properly manage and decrease your risk for future development of cardiovascular disease.
I've been interested in studying vascular dysfunction and microvascular dysfunction that can happen without having obstructive coronary artery disease. As we celebrate February and Women's Heart Health Month and increase awareness, I want to put in a plug for the importance of sex-specific research. It's very important for women to enroll in clinical studies that involve cardiovascular disease because it's only by studying both men and women can we improve care and outcomes.
The Emory Women's Heart Center is dedicated to providing the best care for women in the Atlanta area and surrounding communities. We focus on sex-specific risk factors, treatments, and improved outcomes for women. We hope that you will use February, Heart Month, to learn what you can do for a heart-healthy life. Happy Heart Month!